PH-like ALL is a recently described subtype of B-cell ALL that's characterized by a gene expression profile that is similar to Philadelphia chromosome positive B-cell ALL, but lacks the typical 922 translocation and BCR-ABL fusion. Multiple groups have demonstrated that, unfortunately, patients with PH-like ALL have worse outcomes with decreased rates of remission, increased MRD positivity, and inferior overall and event-free survival. And so these poor outcomes have led many of us to look for ways to improve upon our current treatment approaches. We know that PH-like ALL is characterized by various fusions and alterations that are potentially targetable. And therefore, many current trials are investigating whether adding agents to target these specific pathways may be beneficial. And these efforts have really focused around the two most commonly altered pathways, which are the ABL kinase pathways, which appear to be more common in pediatric patients, as well as the CRLF2 or JAK-targetable pathways, which appear to be more common in adults. For the subtype of PH-like ALL characterized by the ABL class fusions, there's preclinical data as well as numerous case reports that the same BCR-ABL inhibitors that are classically used for Philadelphia chromosome positive ALL, such as dasatinib and imatinib, may be effective. This is currently being studied in ongoing trials by several groups, including the Children's Oncology Group and others. And there's a lot of excitement about this approach, both based on anecdotal reports of efficacy, as well as extrapolating from the Philadelphia chromosome positive ALL data, where adding AI dramatically improves survival outcomes. But I think we should be cautiously optimistic until we have more data. For patients with JAK-targetable PH-like ALL, such as patients with CRLF2 fusions, we have even less data. So in preclinical models, JAK inhibition seems to be effective, but there's limited evidence for clinical efficacy. Nonetheless, there's several ongoing clinical trials investigating the addition of JAK inhibitors, such as ruxolitinib, to standard chemotherapy backbones. And it'll be interesting to see whether these approaches are first and foremost both tolerated and feasible, as well as whether they improve efficacy when added to standard treatments. Future studies will also need to investigate whether other less common subtypes of PH-like ALL can be effectively targeted. Again, as our current approaches really only focus on the two most common PH-like ALL subtypes. It will also be interesting to see how the incorporation of novel immunotherapies, such as blinatumomab and Inotuzumab, will alter the outcomes of PH-like ALL and perhaps make these targeted therapies less critical. There's also some preclinical data for other mechanisms of targeting these PH-like pathways, such as PI3 kinase inhibition, and whether these may be more effective and potentially overcome some mechanisms of resistance will need to be investigated as well. So overall, even though it's too early to really determine whether these targeted therapies will be effective for PH-like ALL, there's a lot of exciting work being done, and the outcome of these ongoing trials and preclinical work will hopefully improve the outcomes of patients with PH-like ALL.